that one. How to prevent a stretch scar after tattoo excision on your wrist? Yeah, I mean, I guess surgeon factors and patient factors on that one. So surgeon factors, from our point of view, it's thinking about orientation of scar. So we would probably want, if we've got a choice. So often with tattoo excision, you haven't got a choice for orientation of scar, because if it's kind of long and thin, you're going to want to put the scar in line with the tattoo, if that makes sense. If the tattoo's a circle, then you can orientate the scar any way you want. But if the tattoo's in a kind of oblong shape, you're going to have, that's going to dictate the orientation of the scar. I don't know if that makes sense, but so yeah, if you have got an option for orientation of the scar, you'd probably want to orientate it longitudinally, so it's not under tension when you move your wrist, because when you move if you put it transversely, if you move your wrist, you're going to put some tension on it, which might make it more likely to stretch. Also, transverse incision on the wrist might look like a self-harm scar, so there's some sort of psychological sequelae, is that the word, or connotations, or anyway, potential effects of a transverse scar on the wrist. So we probably want to, if we can, orientate it longitudinally, and again, if we can get orientation to more the neutral parts of the wrist rather than the here, there's more tension here than if you can put it on the sides. I don't know if that makes sense. So again, if we can do that, that would be good. When we do the surgery, we would probably want to perhaps put some, almost certainly want to put some deep closure in with some deep sutures to take the tension off. The problem with the deep sutures is they can make the scar quite red when they dissolve, and sometimes they spit out and cause problems. But that will help to take the tension off and help with the risk of stretching. In terms of patient factors, then really it's taking it easy. Sometimes when you do really big excisions, you might actually put someone in a splint so they don't move their wrist so it heals properly. Now the risk of that is you can potentially get stiff wrist is the risk of that. So that's a little bit extreme, putting you in a splint, but maybe a bulky dressing, or just saying to you, just try and take it easy, not to try and put too much tension on your wrist, certainly in the first few weeks while it's healing, because putting tension, carrying bags or lifting anything heavy is going to put tension on that wound and increase your risk of stretching it. So being very careful in the first few weeks while it's healing, and then giving it a good massage to try and soften up the scar once it's healed. Usually wait several weeks before doing that to try and soften up the scar and give you the best chance of getting the best scar possible. So yeah, those are the sort of things I would think about if you want to minimize your risk of your scar stretching.